Well, thanks everyone for being here. Again, this is our Health Alliance Senior Circle, and we'll just get started right away. Emmy, if you'd like to go ahead.
But wanted to give an overview of some of what we know about the issue of firearm access in dementia, with a focus on how we can support older adults and caregivers who are dealing with some of these issues. I'm at the University of Colorado School of Medicine. I also am the Deputy Director of the Injury and Violence Prevention Center. Really love working with different community organizations like yours and doing what we can to support the health of Coloradans. And I have an appointment at the VA. So I come at this from a frame point of like, how do we really help facilitate difficult conversations with individuals, with their families to prevent injuries and promote health, the so-called elephant in the room. We do a lot of work around driving, which I think probably all of us here may be a little more familiar with. And we know discussions around driving are really emotional and difficult, and the considerations about stopping driving are complicated for people and need to happen over time with trusted individuals. And so we and others now are working on sort of this idea of what about firearms, and in the context of dementia, how do people make these decisions? So that's what I'm going to talk about today. I do receive research funding from some federal organizations. What I'm talking about today is not the official views of any of my employers or funders. And I need to thank, of course, all of the many, many phenomenal people who I'm lucky enough to work with on all of these projects who aren't here today, but are here in spirit. So this is what I'm going to briefly cover. A little bit what we know about firearm access in dementia, some legal things to consider, and then what we know about what caregivers want from us and what they need. First, just starting with the basics, we know there are a lot of firearms in the United States, and I'm not here to talk about gun control, talk about gun rights. This is really from a framework of what do our communities need from us to make decisions about safety. We know overall in the older adult population, here defined as 65 and up, about 1/3 own a gun themselves. Another 12% or so live in a home with a gun as a non-owner. And then a little bit over half live in homes without firearms. So it's really common. And I think probably most of us know that, but going over the numbers is an important way to start the conversation. We know less specifically about dementia because it's hard to get numbers. There have been estimates of up to 60% based on some clinic studies. My guess is that it's probably, for people who are community dwelling, it's probably more like the regular population, closer to that 40-45% have a firearm in the home, whether it belongs to them or a family member. So certainly then when you think about the growing prevalence of dementia and you multiply it out, it raises questions about, up to 12 million individuals with dementia could be living in a home with a firearm by 2050, which is why it's good for us to start thinking about this and talking about it. So to start off with, this is some work that we did last year. This was from a nationally representative survey of caregivers. And these were dementia caregivers who were all firearm owners themselves. Just a couple things I want to highlight here. So first, these were of caregivers, dementia caregivers who had firearms, who lived with the person with dementia. They said 31% of those individuals with dementia could access the guns in the home. And about 30% said that the person with dementia still owned a firearm themselves. Now, this is not adjusted for level of dementia, and I'm going to get to that later, and sort of thinking about people with the earliest stages and what may or may not be safe. But I think these initial numbers really just highlight that this is something that that at least some caregivers are thinking about and have to face. It's really important that we also take a step back to think about what is the actual injury risk to individuals with dementia and those around them from firearms. And what I want to show here are just some numbers, and many of you may know these trends already, but thinking about both homicide and suicide. You can see the homicides are in red and the suicides in blue, going up by age group from kids to older adults. And these are the rates. And what you can see is that the rates for suicide are much higher than the rates for homicide, which again, I think we all know that, suicide rates, unfortunately, do go up in the later years of life. Not here to talk about assisted dying and so forth, but we know generally that suicide is a concern in older populations. homicide much less of an issue compared to younger populations. So when we think about firearm access and dementia, we really need to be talking about the suicide risk for those individuals. In fact, we know that 91% of all older adult firearm deaths are suicides, and that firearms are the most common method of suicide among people with dementia, again, most often in the earlier stages. We know across ages in the US, about half of all suicides are by firearm, compared to 73% in individuals with dementia. And we know that dementia or a dementia diagnosis may be a risk factor for suicide. I'll just very briefly pause to say the reason that it matters to think about firearm access and suicide risk is because we know that suicide often occurs with a relatively short time period between deciding to act and taking action. So there's lots of evidence that access to things like firearms when someone is having suicidal thoughts increases the risk of death. They certainly still need treatment for all of the other issues that might be predisposing to suicide, but it's a little like having a designated driver, that when someone's impaired, you don't want them to get behind the wheel of a car. It's not about taking away their license permanently. It's about keeping them safe during a high risk period. So it is important, I think, that we acknowledge that one of the biggest injury risks for firearm access and dementia is suicide of the person with dementia. People think more, though, about homicide, and certainly the behavioral and cognitive changes associated with dementia can lead to hallucinations, aggression, agitation, and so forth. So it really depends on the person and the symptoms, but they certainly can pose a risk to others. And these homicides, in many ways will be unintentional because the person doing it usually is not understanding what's happening, and they may think someone's an intruder, for example, and act aggressively towards them. And this is where we kind of get into the same space of unintentional, again, impaired memory and judgment that might affect someone's safe handling, even someone who's always been an experienced firearm handler. For those who are interested, PBS a couple of years ago did a really lovely segment, I think, on this whole topic, including interviews with some families who had dealt with these issues. And there's this remarkable story of a woman who was a caregiver for her husband who had dementia and lived at home. He was a retired law enforcement officer, really wanted to see his gun, seemed like he was doing okay. She thought she had checked it. He shoots her unintentionally in the stomach. She says sort of never even realized what had happened. She amazingly survives, but it's an example of the kinds of sort of so-called accidents that can certainly occur. And she talks about how grateful she is that he never knew that he had hurt her, that he passed away never understanding that fact. And I think that really highlights the difficulties that many caregivers are facing as they think about the emotional needs of the individual with dementia. Okay, so again, suicide is the most common, but we certainly think about the potential harm towards others. So briefly, a couple little basics on some laws and logistics because they inform how we think about this. So the first thing to know is there's no current federal or state law that prohibits healthcare providers from discussing firearm safety with patients. And I think it's important that those of us who interact with older adults or dementia caregivers be having these kinds of conversations proactively about safe storage and reducing access. There are only 2 states that currently have any firearm laws that specifically mention dementia, Texas and Hawaii. And both of them are a little unclear. The one in Hawaii talks about organic brain syndrome, but it's not really clear how it's used. And in Texas, they can't have a license to carry handgun, but individuals with dementia can still possess or purchase. For those not as familiar with sort of the firearm system in this country, there is no national registration or state registration the way there are with cars. So when someone has dementia, there's not a similar process, for example, calling the driver's license bureau to have a license revoked. There's no system like that. So my point in showing you the laws is really just to say there's no legal solution right now to this. This really falls to families to be making individual decisions, which may be the right thing, but there's not like a place really to report people to. When someone goes to purchase a weapon or transfer to another person, they have to pass a background check. It's a federal form, but each state decides when and how it is used. And relevant to dementia is this horrible, horrible old language that you've been adjudicated as a mental defective. This is self-reported. It's a terrible term. It's a whole other topic. But basically, an individual with early cognitive impairment could pass a background check form, because unless they had had a state like a mental health hold placed, or a court had deemed that they were no longer able to care for their own finances, et cetera, there wouldn't be anything in the system that would flag. So my point here is just individuals with early impairment, if they present to a store and seem unimpaired, could still purchase new weapons. Extreme risk protection orders are something to know about. We've had one in Colorado since the beginning of 2020. This is the so-called red flag law. In some states, they're called gun violence restraining orders. I can send some additional information about where people apply for these in Colorado. I really consider these a last resort. So if there are family members who are at their wits' end, they do not know what to do, how to get the guns away from mom or dad, they can apply for an extreme risk protection order. Basically, you submit a request to the court with evidence that the person is at imminent risk of harming themselves or others. And so dementia is one category that could be used for getting assistance from the court and law enforcement to actually confiscate weapons. Only law enforcement and family members are allowed to file these. So it's not something that an agency would ever file, but it is something that we can make family members aware of, again, as kind of a last resort situation. So what is it that we've heard so far from caregivers? And this is where I would really love to hear your insights and stories as well. I think the first thing I would say is that it really varies. You know, there are some caregivers who themselves are not familiar with firearms and are like, oh, geez, I just want to get rid of these things. I have no idea what to do with them. I don't even know how to handle them. You know, there are others who mom or dad was always the protector, maybe in law enforcement or otherwise sort of very safe. And it's hard for them to mentally think about the fact that their loved one might be a risk to them. You know, that's a very difficult thing to process, that to think that your husband might shoot you in the middle of the night, like if in a relationship where there's never been violence before. So I think experiences really vary. From the same survey that I mentioned earlier, again, looking at, these are caregivers who are firearm owners themselves. About 11% said that they had ever had concerns about the person with dementia having access. I think this might be low because it may be that the person with dementia had never had access, for example, or wasn't a firearm owner. And so that might be why it's not a higher number. But you can see that in about half of those cases, they did something. Only about half said that the person with dementia had any plans for what to do with firearms should they become unsafe. And this is, I think, one area where I see a lot of potential for engaging older adults in planning themselves ahead of time so that they can have agency in those decisions. And really importantly, the vast majority of people said absolutely healthcare providers should be talking about this with older adults and with caregivers. But only 5% said they'd ever had those conversations. So there's a big gap here. I'm a healthcare provider. I know we don't do a lot of things we should do, and there are a lot of reasons for that. But this is, I think, another space where we can support providers with materials and resources and how to have these conversations and when. Going back to the risk things I was presenting before, we asked them as well, which do you think is most likely? Accidentally harming themselves or somebody else? Harming themselves on purpose, so suicide, or harming someone else on purpose, like homicide. And what was interesting, but maybe not surprising, is that most people thought an accident was the most likely thing, followed by suicide. And remember, I said earlier, the vast majority of deaths are actually suicide. And so I think that's another area where we can be educating dementia caregivers on the suicide risk. And as much as some people will say, well, I see why the person with dementia wants sort of decision-making over the end of their life, and I can see why they may choose suicide, et cetera, et cetera. I think it's really important we recognize that suicides can be very traumatic for families. And so even if on some emotional level, people might feel like it's philosophically an okay thing for that person to do, it can be really devastating to family who weren't expecting it or who find the body, et cetera, et cetera. And so I think it's really important we be having those conversations with family about that risk. Then we also ask, and this is where you guys really come in, we ask, well, where do you want information about firearms? These are, again, we ask caregivers, where would you look for information and where would you not look? Oh, geez. And, oh, hang on. Oh, no. Hang on a second. There we go. You weren't going to get to see it. That's terrible. All right. Let's see. Are we good again? Yeah, we're good. Okay. So the take home from this slide is that people want all different kinds of things. So I thought it was really interesting. There are, most people said, yes, absolutely would look to family or friends. There were lots of people who said, I would look to dementia organizations, whether local or national. There were some people who said I wouldn't look to those at all. And then there were a lot of people who said they might look towards firearm organizations, and also a lot of people who said they wouldn't use those. And so my take home from this is we need to get this information out through various forms so that people find it in the places they trust. So if you trust your local gun club, can you get information there? If you trust your doctor's office, can you get information there? That there's not a sort of single uniform place that everybody wants it. So what is it, sort of where are we at? What is it really, to get down to what is what's recommended? I think it helps to think about the stages of cognitive impairment, thinking about mild cognitive impairment where there's some initial memory loss and, really people are still pretty functional on their own. Moving into the mild dementia phase where now they're having some trouble with activities of daily living, maybe have some behavioral symptoms, to moderate to severe dementia, where really they're much more impaired. And so for mild cognitive impairment, I think it's around starting the conversation. How are firearms stored? Are there any at home? Have there been personality changes, signs and warning signs for suicide? Engaging someone in making plans for the future. What did they want to happen? Thinking about, certainly referral for treatment and diagnosis of the dementia. There's no evidence that assessment or training by firearms specialists or having kind of a checkup with your guns, like there's no evidence that actually helps, because it's not assessing you in sort of the heat of the moment in terms of what your reaction would be. But it's something some people talk about as a way for family to get a sense of, how is dad still functioning? If you go to the range, does he seem to know what he's still doing, and so forth. Mild dementia, really kind of the same sorts of screening things. But here it's really more about educating that really they shouldn't have any unsupervised access, that probably maybe you go hunting once a year together, maybe that you could still go to the range occasionally together, but really it's probably time to transition away from having unsupervised access. And then generally there's agreement for moderate to severe dementia that people really just should not have access, that this is now where they've moved into a point where they don't have the cognitive function to be able to make the important decisions about how to handle a deadly weapon. I think a really take-home message for how we talk about this is that it's not the person, but it's the disease. And again, so even someone who's been a very experienced firearm handler, safe their whole life, might no longer be safe. And it's not their fault. It's what the disease has done to them, and really continuing to focus on that as opposed to the sort of deficits or issues with the individual. When we think about what does it mean to reduce access, what do we counsel people on? You don't need to be a gun expert. This is where they can go to a firearm store to understand what all the options are. But there are a lot, and there's lots of different kinds of locking devices. The cable lock that you see in red, I think, can be a stopgap measure and a conversation starter, but many people don't really like them. But they're cheap, they're easy to give away if your organization wants kind of some swag to help people have these conversations. They're like $1 or $2 a piece, so that can be really helpful. And then there are much fancier locking devices and so forth, where another family member could have quick access to a handgun for protection, for example, but the person with dementia would not have access. Another thing we think about in dementia is disassembling a weapon or disabling it. For example, by taking a firing pin out, a gun can look functional. So the person with dementia could still be handling it, they might not know. It's sort of like taking the spark plugs out of the car as a way to disable it and avoid some of, if the person's getting really agitated about not being able to handle them. Just say, I've said a couple times, and I really do believe that we should be engaging older adults in these conversations earlier to help them make their own decisions about what they want to happen. We did a survey recently of older firearm owners, and very few had made decisions about what they wanted to happen. And I think that's a space where we can help, but many of them had carried loaded handguns. But as you can see, only about 20% had a plan for what to do if they became unsafe. So there's, this is one idea, Firearm Advanced Directive, not legally binding, really more of a conversation starter for who they would trust to make a decision if they no longer could. And I was hoping to have the materials ready for today, but they're not quite there. I will share them with you as soon as they are. We're actually working on a whole new sort of web-based free resource around this concept. So Joe, I will send it to you when it's available so you can share with the network of resources for individuals on how to make these decisions. And oh, that's weird. There's that slide. Okay, so that's what I wanted to say, but I would love to take questions because this is a huge topic, I know. I think the things to remember in my book are, this is an issue, not for every family, but for families who are facing it, it's complicated and emotional, and we need to be supporting them. We can have these discussions, but there are some complications in terms of legal status and how transfers happen. And caregivers really need usable resources and education so we can support them. And I will stop there. Any questions from folks or comments, stories?
Hey, your information is extremely enlightening. My question has to do with how you're getting it out there. I understand and appreciate your willingness to speak to organizations like this and many others. Are there, though, support groups, caregiver support groups who could benefit from this information? I just would hope that somehow your information gathering and your targeting is going to hone in on where exactly best to pinpoint the problem. I mean, we know what the problems are and all of the different aspects of the problems. My concern is, can you just really hone in and target a group home, for example, or caregiver support groups or something? This is critical information, and it's so sad that many of them die from suicide because they don't have the knowledge. And the other comment that I wanted, that's a question. The comment is, I love the last slide that you showed. I mean, if people have to do their 5 wishes, why couldn't this be included in that?
Yeah, so thank you for that. This is an area that until a few years ago, we didn't know a lot about. So we're finally, I think, getting to a critical mass of knowledge. So we're creating, as I mentioned, and I think it'll be out by the end of the year, some new resources for older adults on this that we're actually partnering with a large firearm organization on, because again, we want to get it out through all of these trusted networks. And we're working with some of the bigger Alzheimer's and caregiving organizations. But what I would love from you all is, as these things develop, if you have ideas about how we can share locally as well, because I really do think it's how do we get information to people in multiple ways. I don't have the money for the big massive PSA campaign yet, but maybe we get there someday. And then there's a lot of interest from the healthcare side too, I will say, especially at the VA, since this is a huge issue at the VA. So, there are a lot of people thinking about how do you incorporate this into routine screening or counseling, healthcare provider teaching. So I'm right with you. I feel exactly what you're saying. Yeah.
What comes to mind is the young man that was in a skilled nursing facility earlier this year or latter part of last year, who killed somebody in the facility. He had a firearm in that community, in that facility, and he should never have been able to do that.
Right. And most facilities, I think, have policies where you're not allowed to have them. But so I don't know in that case if it's that someone brought it or he was sort of not following the rules. But it's hard. It's complicated. And that's where I think a lot of this really needs to come from family members kind of making being a little more proactive in some of these decisions themselves. And I will just say, we've done lots of work with the firearm community and retailers and ranges and instructors. But everybody agrees that people with significant cognitive impairment should not have guns. Like, that's not it's sort of the same thing as like little children shouldn't have access to guns. Like, there's no disagreement on that. So it's really more, how do we do it? As opposed to some of the kind of rights debates that we have in other topics. So thank you for your comments, though.
You're welcome, and thank you for your response.
Thanks.
I just want to say on Jeannie's note, that's a really good idea, Jeannie, the caregiver support groups. And just wondering, I don't think we have anyone from Alzheimer's Association on here, but is there the ability to maybe partner in terms of promoting that way, or with the Caregiver Respite Coalition and those types of organizations?
That's great. And I don't know about the respite organization, but I will look into that. So we've been trying to work with Alzheimer's Association and some of the other kind of caregiving groups and so forth. And I would say we're actively exploring all of that right now, including through a new NIH funded grant that we have to understand how to reach caregivers. So stay tuned.
Awesome.
Maybe I'll come back to you next year and
Yeah, please.
we will have figured it all out. No, but along the way, I think it's also, as Jeannie mentioned, how do we incorporate this into other advanced planning things? Like when we're talking about driving, when we're talking about home safety in the stove, when we're talking about financial planning, to some of these major decisions, to sort of just sneak it in there and it becomes part of the conversation.
Yeah. And I just want to read Joan's chat message. My dad had dementia and always had firearms around. It was scary at the end. And if you have any, if you can add to that, Joan, about were there conversations, was there something that worked well, or was it just kind of I know sometimes you plan to have conversations and then things just happen and there's not much to do about it. But I know with my folks, and not really around the gun issue, but around driving, I've already talked to my parents to say, in the future, if I start to feel like there might be some unsafe things, how do you want me to talk to you about it? Or what's the best way to approach? But, it's tough to plan for these things, but certainly if I love that idea of incorporating that into advanced planning. That's great.
Yeah, I think, Joe, that's a great point. And one thing we've heard from people in focus groups and interviews is that there's so many similarities with driving. But one of the key differences is for driving, they're actually amazing resources. Thank you, DRCOG, for your amazing getting their guide of all of the alternative transportation options. For firearms, it's harder because, most people have firearms. The leading reason in the United States is for personal protection. A lot of older adults, it's also going to be sentimental, or maybe they used to hunt and so forth. So what is the substitute there, and how do you make sure that they still are feeling safe if that's what it was for, or that their family still feels safe and so forth? There's not sort of the same substitute in some ways. And I think, but although it has the same, if not more, emotional heaviness that is really so linked to independence and responsibility and things, and to feel like you have to give up these things, that is a huge blow for people. So that's where we're trying to encourage a sort of proactive idea of what is your legacy as a firearm owner, and what do you want to leave for your kids or your grandkids, and what are some of your stories, and who do you want your guns to go to, and things to have a bit more of a positive spin. But it's still really hard. And it's the stories like Joan's of, it's really hard and scary. And we don't know how often there are near misses, but I think there are more than are recorded for sure.
Thank you so much, Emmy, for that information. That was really helpful. And we'd love to have you back as things develop, or if we can help promote the information and messaging, we'd love to do that. So
great. Thanks. I have to run. I'm sorry to not stay for the second half, but please feel free to reach out to me if you need anything. And thanks for all that you all do.
All right. So let's move on to Cassie and Erika, who are going to discuss the new white paper on housing.
Yeah, hi, thank you for having us. Oops. All right. So we recently did the white paper labeled Locked Out, and it really focused on what we are calling the invisible population of older adults who are experiencing homelessness. So this is talking about, this is a PowerPoint we created for Change a Trend, which is a collaboration in the Englewood area that we participate in just to get some awareness. So this is a little bit about us, the area agents on aging, and all the different areas we serve, and the different programs we have. I'm just going to skip through it so we can get to the data on the older adults, which is reflected in our white paper. So when you go, if you have a chance to read it, it has a lot of great data points about older adults who are experiencing homelessness. So the data we do have, so about 2,525 are experiencing homelessness for the first time in a recent survey done for older adults compared to the prior year in 2020. So there was quite a huge jump for older adults experiencing homelessness. So US Census Bureau did a survey for older adults where 33 of the respondents said, who were 65 plus, said they had slight to no confidence in their ability to pay rent. Many of our older adults are on the verge of experiencing homelessness, or because they no longer can afford the rent here in Denver, they have to couch surf. So oftentimes this population isn't captured in a lot of the homeless data studies because they're not actually utilizing homeless serviceness and staying in shelters, but they're staying with friends or children, but not always are these situations safe or even accessible. And they're often trapped in those homes because they can't get up and down flights of stairs that are walk-ups, that are apartments and things like that. So the Senior Support Services of Denver is the primary homeless outreach agency that serves older adults in Denver area. So their data from 2020 so they served 1,540 seniors. Their average income for those individuals was only $779. 75% of those individuals identified as homeless. 85% were at risk of becoming homeless. 90% is identified as having no support systems, and 70% identified as physically frail or disabled. And so part of what we're addressing in our white paper was talking about the limited service options for older adults in the Denver metro area. Senior support services is primarily the only option. Oftentimes, when we refer older adults or adults with disabilities to the shelters, they are turned away because their needs cannot be met at those shelters. That's one of the things that we're trying to highlight in this paper as well. We have direct stories from this year of older adults and adults with disabilities unable to access shelters because they needed significant support with their ADLs, and the shelters don't accommodate that. There was another situation where our program manager of our case management department was trying to access the voucher program that is accessible through Denver, and they were turned away, even though there is, hold on, I'm trying to find the data, it's in our paper. I think about 30% of the beds are vacant in this voucher program, and she met 2 of the 3 qualifications to access it and was still turned away. So seniors are a high-risk category that is often underrepresented in the surveys, as kind of I mentioned earlier. So when we get a fair amount of housing-only referrals to our information and assistance line, we had 61 housing-related referrals in August, 71 in July, and then we had 164 referrals made for housing and housing search in August. We are every day getting calls for people who need housing, who are about to lose their housing and have no place to go. And one of the things that's a challenge for the folks that we work with is the access to apartments or facilities that are ADA compliant. There's only an extremely small number that, I'm trying to find it. It is also in our paper. This is the exact numbers of units available that are ADA compliant or wheelchair accessible, that have the ability to get in and out of their home with a ramp or have an elevator in an apartment complex.
And I was able to put the white paper in the chat. Hopefully
Great.
that will work for folks if you're able to.
Thank you. So some of the barriers to shelter and traditional supports is oftentimes older adults or adults with disabilities have things like oxygen they need to plug in. They have diabetes, they need to be able to store their syringes, which is often not allowed in shelters. A lot aren't able to walk without assistance. And some just physically can't take the time to start standing in line at 4 o'clock to be able to even access the shelter. So, oh, there it is. Less than 1% of housing units in Colorado are wheelchair accessible. And there's more people than that who need affordable housing who have wheelchair accessible, who need wheelchair accessible units. So oftentimes even our older adults or adults with disabilities who have their own home are running into barriers because they can no longer keep up with the maintenance of their home. And we have quite a significant amount of folks on our case management program that are currently working with public health organizations because their home is at risk of being deemed unsafe. One couple in particular, the county, the public health department deemed their home inhabitable, and they camped outside during the day and then snuck into their house at night to be able to have a safe place to live because they couldn't go anywhere and they couldn't afford to find their own place. We've had callers call because their home was inundated with mold and it wasn't a safe place to live, and they didn't have, because they're all living on a fixed income, the ability to pay to have that mitigated, because that is in the thousands and thousands of dollars. Those are just a few examples of the many examples we get on a daily basis. So we're trying to figure out ways, and part of the white paper is asking the hard questions on how do we meet these needs and how do we identify ways to move forward. So we have policy recommendations. I don't know, Cassie, if I'm talking all the most. Do you want to talk about some of those policy recommendations?
You're doing really great. But I can pick it up from here if you're tired of talking.
I can keep talking. I just didn't want to.
No, you go ahead. If you've got it, roll with it.
So there's a lot of money coming at us. The problem is sustainability. So we're looking at ways, how can we support this group now, but in 2 years, once all of the uptake and all the COVID funding that is flooding all the states, what are we going to do in 2 years to help continue to support this? We don't want a cliff effect. So we're trying to find ways to do that. We would like to recommend streamlining application processes for affordable housing. One of the biggest challenges we've always constantly run across is how does somebody apply for housing? Because there is 1,001 places to do it, and they're all for different units and they're not all the same. And then it's just looking at different ways on how we could partner together with agencies that are already doing the work. We don't need to reinvent the wheel. There's plenty of hotel voucher programs out there, but how do we make them more accessible and safe for our older adults and adults with disabilities? So one of the last things, so the point in time survey that is done every year. Last year, they only surveyed the people in shelters. They did not survey both sheltered and unsheltered individuals, but the numbers did grow from the previous year. So last year, this year, sorry, in 2020, in January 2021, feels like last year to me, sorry. They found 358 individuals who were 65 plus who were in shelters and 1,115 who were between 55 and 64. That was an increase from the year before of 59 for adults 65 and older. And of those 358 individuals who were 65 plus, 113 reported having chronic health conditions, and 133 identified as being newly homeless. So it is growing. We see it constantly in the phone calls and referrals we get to our programs. And that's kind of a basic summary of that white paper. Did you want to add any more, Cassie?
I think the only thing that I thought to add was we got some feedback from the Colorado Gerontological Society, who mentioned that a lot of older adults in the Denver area have resorted to living in their cars, and that's become a lot more challenging too, because places that traditionally would let people park overnight, like Walmart, aren't letting people do that as frequently as before, and municipalities are really cracking down on people parking at other public spaces. And so it just feels like from all sides, our older adults are just losing options for places to exist. Their property taxes and the cost to upkeep their homes and all of those things are becoming much more expensive. And so they're very quickly being priced out of communities that they've lived in for a really long time. And I mean, I feel pretty confident in saying I haven't seen any adjustment in resources or benefits that are easy to access to really combat that. There's a lot of talk, and I think, we've kind of seen it on our side too. There's talk of money, but as far as that money transferring into services and programs, we haven't seen that, with COVID dollars and other tax initiatives that we've had more recently. It just either the need is just growing so quickly that even any money that we're throwing at it isn't seeming to help, or we're making it so hard for these people to access those supports that it's unable to really make a difference. So we have our lobbyist, Rich Morrow, who is actively conversing with our big decision makers at the Capitol to see really active change. Our director is constantly meeting with other entities to see if there's opportunity for us to partner, to see how DRCOG might be able to play a role in providing some type of transitional housing and or the wraparound services that people need to prepare for more permanent housing. Because that's the other thing, is that a lot of people, they have a lot of skill building needed in order to maintain housing once they have secured it. So it's a very multifaceted issue. There are a lot of players at hand. And hopefully we'll start seeing some movement with all of the advocacy that's happening now. But I don't see it happening fast enough because I feel like we're already behind the 8 ball. So
yeah, I know from one of the folks on our team attends the Change the Trend meetings weekly, and their pre-enrollment slots are completely filled up to enroll in emergency shelter in the winter. Our folks can't physically get to a lot of these places to enroll, and then they don't have the ability to stay in line and wait.
Yeah, a lot of people go unserved. They kind of call this like an invisible population because they'll, like Erika was saying, they kind of get trapped in living with friends or family or acquaintances. And so then they're not getting service, medically or nutritionally, because they're just, they can't access our support systems from within their home. They might not get a lot of good information from where they're staying. So I think that there's more people struggling with this than maybe we even see in the shelters. We're seeing the shelters get more and more busy. We're seeing those stats, but I think there's a lot more going on beyond what we can find in those numbers. And so I know Jeannie has a question, and there's a question from Joan too. So I don't know, Joan, if Erika, she's the one who pulled the most of the data for this conversation. Do you know if there's a percentage difference or what the percentage difference is between male versus female for people?
Give me a few minutes and I'll see if I can get it. It wasn't part of our paper.
And Jeannie, what is your question while she's
My
working on that?
question is a very curious one, folks. Given the numerous calls that you are receiving almost daily from people from varying circumstances, what is being done by DRCOG to be more proactive in this area? I saw your last slide and I liked some of the things that were on there. Let me just give you an example of why I'm asking. My 83-year-old aunt is in jeopardy of being homeless. Technically, realistically, I would never let that happen, and she can certainly move in with me. Her rent is $991 a month. She's in a one-bedroom apartment, been in this development for 12 years. It has just gone up to $1,048 a month. That might not seem like a huge leap for somebody else. However, she only has one income, which is Social Security, and that check is $1,500. I spent some time on this on Monday, and Tuesday too. I called the Housing Choice Voucher Program to see what the qualifications were to get her in a voucher program or something. I called over to the Aurora Housing Authority, and I haven't heard anything back yet. What are we doing to be proactive? What can I do to be proactive in assisting her?
Yeah,
You need to go back in time. I mean, unfortunately,
the systems are so broken.
Yeah.
I think, you know, what DRCOG is doing is we're taking it to the legislate, because housing is not something we've ever been funded to provide. That's not part of older American dollars. We're looking at how to, we've gotten some direction where we can be a little bit more flexible with some of the dollars that we have. But the last thing we want to do is just add another complication to the cog of housing. We want to advocate and be part of conversations that encourage a more streamlined way to receive housing, to receive the wraparound services to help maintain people in the housing that they have. And so we advocate for, not that this is anything that has really come to fruition, but we advocate for things like the ability to stack vouchers. Right now, people can use one voucher to pay their rent, and you know, a lot of times it's not enough. And so we advocate for things like voucher stacking. You know, we partner with Sunshine Home Share to see if we can get people sharing homes and living, you know, more as like a unit, supporting each other's needs, supporting their ability to live independently. It's a lot of times the work that we do is like out of the box thinking to try and like put band-aids on the systems that we have. But overall, there needs to be a major shift in how the state of Colorado approaches housing. Another thing that I know our director would love to do, if she had the ability, would be to purchase apartment complexes that the area agency on aging would manage. We've also talked about voucher programs for hotels and those kinds of things. It just all takes a ton of administration that we don't know how we would get paid to staff those programs. We might find some service dollars, but a lot of times they don't build in, our funders don't build in the amount of admin that is needed to maintain those services and support those people. So right now we're in a very huge just push for advocacy before we really feel like we can make an impact. So I wish we had more solutions. And honestly, that's what we do with the majority of callers. who call in for their housing needs, all we can do is some really creative problem solving with them and have some really hard, realistic conversations. You know, if someone's in housing and they don't like it, what can we do to make that housing situation better for you? Because the honest truth is that it's going to be years before they find a better housing solution for themselves, if ever. So.
As far as housing, the housing conversation in general, we have a meeting with health alliances throughout the state, and we talked about housing today. And Mile High Health Alliance, which just kind of covers the Denver metro area, is going to be doing some mapping around what kind of climate equity in schools and identifying areas of housing instability. And one thing that was mentioned is that I think it's 2 unpaid water bills is a good indication that there may be, that person is at risk of potentially becoming evicted or, you know, getting right on that line. So that was a really interesting discussion around, you know, are there ways to even plug into the water companies about, you know, information to help, again, you know, more preemptive steps to take. But yeah, certainly this is an issue that's only exacerbated by the pandemic and not new. I saw Rich and Bonnie come off of mute. If you wanted to chime in.
Yeah, thanks, Joe and Erika and Cassie, thanks. And you mentioned, you alluded to, and I think Bonnie knows this, there's lots of resources out there. There's lots of programs in our various municipalities and suburbs and within Denver, Aurora, and all of that support housing, but there's no centralized hub of it. And I think that's part of the complication. Do you guys know, is there any state that is doing what you would say is a good job, or at least a decent job, or a better job in handling the homeless crisis for seniors or for anybody?
I don't know of any.
I know it's nationwide, but I suspect there are some states out there that maybe do a better job, a little bit more centralized control, maybe a smaller state, a smaller population of the state. But
everything I've seen has been more localized versus it's more like cities create a specific program that's helping that specific city. I've seen a lot of that in the things that we researched, but nothing that spoke to one state pulling it together. It's very localized.
Okay.
One model that our director is really interested in, I touched on it, is the Area Agency on Aging in Toledo, Ohio, did purchase 3 apartment buildings. And they're able, through those buildings, they're able to provide housing to 196 older adults. And I think just putting it through the Area Agency on Aging, I couldn't tell you, if they're what vouchers they're taking, but I know it is a partnership with HUD. And that's been a really wonderful thing, not only for the older adults that get to live in more sustainable housing, but it's been a really huge help to the Area Agency on Aging because it's privatized some of their funding so that they're not fully reliant on grant government dollars. And so it's been really cool to see that platform, because then they can turn the dollars they're making off of those apartment buildings and turn them into more services. So that's something that we're looking at, but I think our ability to do that is largely outside of our control. We can advocate for it and see what happens, but it's a great idea, Rich, to look at what are people doing well and how can we emulate that, and do it for ourselves.
I really appreciate this discussion. I am involved with a group in the Southwest Metro area, Hat Force, which is part of Change the Trend. And I guess I just share in everybody's frustration. I don't really have any answers. Our group does hotel vouchers on severe weather nights, and we have added people 65 and over as a specific category we didn't serve before. However, all we can handle is severe weather nights. So
Mhm.
at this point, and there's a lot going on. There's the Tri-City Policy Group that includes the county commissioners, city planners. But everything possible seems to be 2 or 3 years out. You know what I mean? We can try to get a shelter. We can try to get supportive housing, but the people need it now. So the only possible encouragement I have, this is very small, but there's a group now called the Colorado Poverty Law Project that has just expanded hugely. And their goal is to try to keep people in their places. So they will, I mean, I guess I'd offer that if somebody's at risk. I don't know if they have the answers for everybody, but they will try through legal means to help that person stay in their apartment and find some assistance that may help add to their income. I don't know enough to know. They're gearing up. They also have a whole legal policy section that will be lobbying with the state legislature. So for better,
Yeah.
but I don't
Thanks,
know.
Bonnie. Yeah.
And I guess we're all frustrated, but because this is only one population also that is in the same box in Colorado.
Yeah. I've used Colorado Poverty Law Project for help for folks who live in mobile homes who are their rents are pushing them out. Also, that's a big push that I've used them for.
SMHO is also in works for a senior living facility off Powers and Eladi, not immediate, but something. What's SMHO?
South Metro Housing Options.
Oh, okay. Interesting. Do you know, Courtney, is that going to be not like a long-term care community, but just an affordable living community?
Yeah, it's based on senior living. I think there's going to be about 80 units for, I want to say 60 or 65 plus. They're still looking to finalize funding and finalize everything, but I do know that the wheels are in motion, which is awesome.
Yeah, that's good to know. Thanks for that.
I think one of the bigger advocacies we're pushing for is bringing everyone together, because there's a lot of people doing a lot of things, but it's too much and too many different things. And that's where I think our big advocacy push is going to be landing for a while, is condensing and saying, why do we need 100 different applications to apply for 100 different senior housing apartment complexes? So.
Jeannie, did you want to?
I do. I was talking with one of my walkers this morning. I walk with a group of people at the Aurora Mall 3 days a week, and we got into a conversation about housing. One of the young ladies said that she was told there is an affordable housing development being constructed on Sable Boulevard here in Aurora between 6th Avenue and Alameda. Are any of you all aware of such a creature? Okay, thank you.
I know that there's Lairden, which their campus is up like Brighton Boulevard, north of I-70 there. It used to be a school for children with special needs, and now they still do a school there, but they do all kinds of programs for adults with developmental disabilities and other vulnerable populations. And they did build some apartment complexes on their property that they're working to fill. And it's just a really slow process, and the application process it's really hard to qualify. It's frustrating because you see these open units and people who need housing, and there's just so many hoops, and people have to have access to, not Lairden specifically, but having access to a computer, or, being able to get there to see the property. There are just so many complicating factors that make it hard for people to even access the resources that are available. So.
But just I want to say thank you to Cassie and Erika for presenting this information. Thanks all for coming.